Good evening, everyone, once again, and thank you all for joining us yet again for another interesting topic, sleep hygiene. So, the misery of staring at the clock while you try to shut your brain is an agony which almost everyone experiences at one point of our life or another, right? So, here we have Dr. Pradeep, who is going to explain to us about the right way to go into a sleep, or what if there is a problem, how to solve it, and how to address it. So this problem about the insomnia or sleepless nights is more common amongst the elderly, and it could be multifactorial. It could be a mental or a physical reason behind it, or it could be a simple lifestyle change. So if it is a lifestyle change, why not address it and have a good night's sleep, right? So that is the whole idea about this program. A brief intro about Dr. Pradeep. Dr. Pradeep Palnayappan is a psychiatrist. Currently, he is the professor of PSG group of institutions in Coimbatore. He is also practicing a consultant psychiatrist in PhD, as well as his own clinic, Mind and Care. He has completed his post-graduation from NIMHANS, Bangalore in the year 2006 to 2009, and has worked as a senior resident in NIMHANS. He has been associated with the PSG hospital since 2011, and right now in 2022 has been promoted as the professor. So at PSG he has been involved with the geriatric clinic, where diagnosis, assessment, treatment of elderly is the main focus. He has been resource person for many interactive workshops and stress management, geriatric health and pediatric problems. Yes, he has been invited once again for Growing Young. So earlier he had addressed about the mental health in seniors, and today he is going to talk to us about sleep hygiene. Thank you, Dr. Pradeep, for joining us yet again. Over to you.
So good evening, everyone. Am I audible?
Yes.
Yeah. So it's a kind introduction, and I like to be in this stage second time. Probably initially we spoke about more about the mental health in elderly. So this time I thought I will focus more on sleep hygiene. Uh, Sunanda called me about a few weeks back, around 6 weeks back, and spoke about this topic. Then I thought, I think it is a right time to talk about it. I think a lot of concerns have been going around secondary to the sleep problems, and a lot of people do have this problem, which are many times unrecognized, probably not even consulted, and not even a help sought. And many people continue to suffer with this insomnia. All may not be having an illness, but many people who have sleep disturbances could be age related, or it could be just a sleep concerns which can result in anxiety and then result in sleep disturbances. So I thought I will more focus on this area. That will be the current understanding as of now. There was always a myth that sleep is actually an art. But if you carefully dissect out, I'm here to say it is not an art, but rather if you use certain techniques, in fact, everyone will be able to sleep, and you need not have a boon to sleep. Yeah. So I will rather, I think the first slide which I showed you, which will definitely you all want to have a sleep as blissful as this lady is. Am I right? Yeah. Yeah. So I believe that everyone wants to sleep so blissfully and peacefully like this lady, right? So we will go one by one. Probably initially I will focus on a small a case, or on a story of another elderly woman. And then gradually, as I went through many of the questions which have been put forward by many people, and I saw that many want to know how the sleep is and how it changes through the elderly, and how much sleep is required. So I will touch on that and then move on to probably what are the sleep hygiene techniques which need to be followed. Is that okay? Right. So can we move to the next slide? Yeah. So this is about a friend. So Mrs. X, who is sitting in a metropolitan city in India. She lives with her husband, She has a daughter, and they have all got settled probably outside her town. So she and her husband are at a home. She's off late. She has less work to do. Probably she gets up whenever she wants, maybe 7 a.m. or in 8 a.m., and goes to bed whenever she wants, probably even in the afternoon as well. So she sleeps probably 1 to 2 hours in the afternoon to kill time. She finds difficult to sleep at night. It takes 3 hours for her to actually sleep. Next slide, please. So our friend gets up in the night, checks her WhatsApp, sees drama serials or movies to kill time as she is not able to sleep more. She looks forward to sleep but gets worried that she is not able to sleep. So in order to pass on with the time, she walks, does counting backwards, strains herself but still not able to sleep. So this is a common scenario we do see. Yeah. Next slide, please. Yeah. So before going on to thinking about what went wrong in our sleep and how to probably improvise it, first probably let me understand that why do we need sleep? Sleep, absence of sleep or lack of sleep has been probably linked to various medical disorders, psychiatric disorders also. But sleep has its own benefits. We know that sleep helps with energy conservation, with probably recovery to the work next day. Probably also it helps in formation of memory during sleep, and probably through dreams sometimes it can also help in discharge of emotions. Next slide, please. So I will briefly touch down about the stages of sleep. So we all have probably two types of sleep. One being the non-rapid eye movement sleep, which we usually call this as NREM sleep. And then we have a REM sleep, which is rapid eye movement sleep. So these are two type of sleeps which we all have, and the simple difference between these and that is NREM sleep is a deep sleep, whereas REM sleep is a superficial sleep. So as you see in this tabular column, so REM sleep is where you will have a lot of rapid eye movements. Probably you have constantly your brain cortex will be active, your muscles all will be paralyzed, but you will be dreaming a lot during that period. Okay. Whereas in contrast to that, the above first three things, that is stage 1, 2, 3, and 4, are nothing but NREM sleep, which is otherwise called as deep sleep. When probably we are very asleep, we don't recognize what is happening outside. We dream, but we don't remember those dreams, and many times our body becomes very placid and relaxed at that time. So next slide, please. So if you see the normal sleep is to put out this diagram in a nutshell, if you have, let's say, 7 to 8 hours of sleep, the initial 1 hour will be a deep sleep. So as we all will recognize that once we are put to bed, we immediately sleep off. So that is the deep sleep. Then gradually, as it becomes more by around 1 o'clock, by around 3 o'clock, lot of superficial sleep comes in. So our sleep is not a uniform deep sleep. Everyone goes through the cycles. That is a cycle of deep sleep, then go to the superficial sleep, then a deep sleep, then a superficial sleep. But as the sleep prolongs, that is by around 3 o'clock to 6 o'clock, most of the time what we have will be superficial sleep. So it is quite normal to have superficial sleep during the last 3 hours of the sleep. So many times we will be able to remember the dreams during the superficial sleep. So many times when we wake up after a superficial sleep, we often have the experience that we are always dreaming. We almost think that the entire sleep went on in dreaming, right? So we often get the feeling that the sleep is non-refreshing. We feel that we have not slept at all. We have just dreamed the whole night. But believe me, that dream would have just started few minutes back, but you would have traveled several hours and days in that dream to such an extent that you will feel the entire night you have been dreaming. But actually speaking, the superficial sleep would have just started few minutes back. So it is quite normal that during the initial part of your sleep, you will have a deep sleep. During the later half of the sleep, you will have a superficial sleep. I think superficial sleep is definitely necessary, or else we will not be able to wake up directly from the deep sleep. So I think we will not have, in our younger days, when we are in deep sleep, someone would have woken up and we will just get up, and then we feel that we are not able to come out of the sleep, go back to bed, and only after 5 to 10 minutes we get up. So, right? That is the deep sleep. So if you are woken up in the deep sleep, you may not be able to perform. So superficial sleep is a way, a body mechanism, so that when you get up in the morning, it will be easy for you to come to your routines. Okay. So next slide, please. Yeah. So yeah. So hours of sleep. So people often ask me how long a person should sleep. Uh, I will rather say commonly we all have to sleep between 7 to 9 hours, but it is not strictly 7 to 9 hours. It may vary from person to person, and it also gradually reduces as people catch up age. We all know that our body clock is a 24-hour clock. So even if does not, we don't see the time on the clock, our body clock ticks every hour as like that of a clock which we see on the wall, right? So usually it is, we need 7 to 9 hours sleep, but it is quite common that at elderly more than 60 years, the sleep reduces to 6 hours. Next slide, please. Yeah. If you look at this circle, if you can if you can see at the 4 o'clock position, right? Just imagine that this is a clock. In the 4 o'clock position of the shorthand 4 o'clock position, you will see that I've written 65 plus years old. Yeah. So the in the 6 o'clock position is the 1 to 2 months, 12 months. That is first year baby. The duration is compared. If you see, we all sleep around 14 to 18 hours per day when we are at age 1. But when we are at 65 years, it is quite normal for us to sleep only 7 to 8 hours. So if you closely look through this circle, gradually the number of hours reduces as we catch up age, and it is quite normal and possibly adequate for that age. So it is we need not become dreadful if we sleep less during this age. And this source is from the NHS UK, which has been National Health Services in UK, so which has been shared worldwide across, and everyone also accepts this, that these sleep duration gradually reduces as we catch up with age. Next slide, please. So if we have to improve sleep, let's say there are so many people who are not able to sleep for 7 to 8 hours. So if we have to do that, then probably we need to look out what strategies we can use to improve our sleep, right? So there have been a lot of suggestions about what might help to get a good sleep, not only from the doctors but also from the Google. Different things work for different people. So there is no one unique strategy which helps for all people. So each people have to try their own permutations and combinations of sleep hygiene techniques to improve the sleep. Which helps for us, I think we should catch on to it. Okay. And many times these ideas don't work instantly. So it is not like I started today and I start to sleep very well as expected from tomorrow. It takes days and weeks of practice before expected sleep occurs. Okay, sure. Next slide, please. So I will start with few simple techniques which have been worldwide accepted, which is probably scientifically proven, and which do help in many people whom I am seeing as well. So one being the lighting. So I often say, and it also scientifically proven, that more the room is dark, better is the sleep. So in fact, people used to sometimes it may be a room where even if the curtains are on, if the curtains are not thick enough, it may still light can penetrate into the room and may make it more probably bright. So you may not feel sleepy. So as a result, think about whether there are options to keep your room dark. Okay. Or the other way may be to have a traveler's eye shield like thing which covers your eyes so that it keeps you dark. Too much light has been known to disrupt something called as melatonin. So this is one thing I think everyone should know, the relevance of which I will talk about later as well. The melatonin is a normal hormone which we all have, and melatonin is otherwise called as the sleep hormone. And it is quite normal for all people to probably get a peak of melatonin by around 1 hour before sleep. So when we get a peak every 24 hours, if let's say I usually I sleep by 9 o'clock, my body clock will keep it such a way that my melatonin secretion in my body peaks at by around 8 o'clock. That is 1 hour before my bedtime. So once that peak occurs, I gradually become sleepy and then I am able to sleep by 9 o'clock. So many times, if there are too much light in the room, this disrupts the melatonin surge. So as a result of which, you will not be able to go to sleep. So try to look out whether lighting can be reduced and your room can be made more dark for a good sleep. Next slide, please. Next being the temperature. The temperature of the room should be probably kept not too hot and not too cold as well. So many times at 24 degree to 26 degree should be an optimal temperature. So many times we are often use air conditioner before we sleep. So there are so many people who freeze because of AC, right? So, or there are so many people who keep it too high that they sweat a lot during the night. So keeping it 24 to 26 degrees Celsius is ideal, not only for the body, but look out at the comfortable temperature throughout the night. Okay, next slide, please. Yeah. Then the important thing which I wanted to speak about is also about the gadgets. So I do see a lot of people who say that they try to go to sleep, but they are not able to sleep. So they don't know what to do. So they just take out a mobile or an iPad or probably like Kindle or laptop or see a TV, all those. Yeah. So what happens is that initially a delayed sleep which many times results in worries whether you will get sleep or not. Not getting sleep, whether it can be detrimental tomorrow, or not getting sleep, whether it will reduce the next day work performance, or not getting sleep, whether it can result in a lot of uh, health hazards, and or a thing about tomorrow what to do, or worries about the family, worries about the future. So one worry branches out to one another. So people get frustrated with it. So what they do is that as a part of diversion, they start to use gadgets to divert from their worries. When they use that, we all know that the gadgets, the light which comes from the LED screen of the gadget, especially the blue light within that, or otherwise in technical terms we call the blue wavelength of that light, is a direct suppressor of the melatonin surge. So the more you look at the gadget, the more you see at the light basically inhibits the melatonin surge. As a result, that will result in probably sleep disruption. Again, going into the same cycle that your sleep is delayed, you again have worries, again you continue on with the gadgets, which disrupts your sleep, and this sleep cycle continues on. So next slide, please. So I will rather say gadgets, please turn off all screens including all LED screens, 1 hour probably before sleep. There are a few people who probably think about using something called as eye shield in the gadgets. So eye shield is a feature in many of these gadgets nowadays, which cuts off this blue light so that the screen, rather than looking white and bright, it looks yellowish. But still it has not been proven that it is good for sleep. So we still know that yellow shield or the eye comfort shield is not the probably the better way, and it is best to turn off all LED screens an hour before the sleep. Especially also work on with making it offline. Many times due to phone having repeated WhatsApp notifications, that can also probably disrupt your sleep. Next slide, please. Then probably another way of improving the sleep is to make the bedroom very relaxing, rather decluttering. Okay. So many times keeping it tidy, keeping it pleasant, in fact, improves the sleep milieu, and then it improves your sleep as well. Next slide, please. So if you see, definitely there are so many people who start to treat bedroom as an extension of an rest of your house. So as I would rather request everyone to use bedroom as just bedroom alone. So you use bed only for sleep, and you don't use it as a sofa. You don't be there on the reclining thing to enjoy something, seeing a TV, or to use gadgets. So strictly make the bed only for sleep. And also a tidy room makes the mind also very tidy. So it will have definitely results in a restful night's sleep. Okay. Next slide, please. So another thing which also need to work on is the daytime naps. Uh, let's say there are so many people who feel that the last night's sleep is not so refreshing. And another thing, probably before retirement, there are a lot of works, and before so many years, there were a lot of works to get engaged on. Now, gradually, we get lot of time without any major work to do. So, what people generally happen is that they doze off involuntarily, or sometimes we get bored and we start to have daytime naps. So we just nap on the sofa, we just nap on the table, just 1 10 minutes, just 1 15 minutes. There are some people who do that. There are some people who feel that the night sleep is not good enough and try to compensate the next day with probably an hour after the breakfast or an hour after the lunch, and then that goes on. So what they feel is that uh, these compensatory daytime naps are considered refreshing, and they feel that doing that, they feel more regenerated. But we need to also understand that they become less tired in the morning. So what happens is there is no sleep pressure. So what is this concept of sleep pressure? Sleep pressure is that you create a pressure for the body to sleep. So you create the pressure by not sleeping in the morning. You don't give time at all in the morning for your body to rest. So you are the result of which the sleep accumulates. You distract every time you feel drowsy. You distract, but you know not allow the body to sleep. Then the sleep pressure increases. So with that sleep pressure, when you go to bed, you will be able to sleep immediately. But because there is compensatory daytime naps, you don't get that sleep pressure. You become more refreshed. You are not tired. So as a result, you don't develop that sleep pressure. So as a result of which, sleep, you don't sleep at all. Then associated lot of thoughts come in, and then again that night sleep also get disturbed. Then the same cycle. So next day again you compensate to again good for a daytime nap. Again the cycle goes on. So daytime naps are probably definitely need to be avoided if you have sleep difficulties. So we need to create a sleep pressure by avoiding daytime naps. Okay. Next slide, please. So, what to do if not daytime naps? Just maintain a regular bedtime routine and sleep pattern. In this, what I mean is that the time to go to sleep and the time to get up has to be very, very clear, irrespective of how many hours you have slept at night. So, barely you would have slept 2 hours, but still going to bed, if at all, if it is 10, it should be 10 daily. And if at all it is 6 a.m. in the morning, you get up, then also it should be 6 a.m. in the morning, irrespective of how many hours you have slept at the night. So do not nap during the day and always create a sleep pressure. When we have a sleep pressure, if let's say 2 or 3 days you are not slept and you allow your body to sleep only between fixed sleep schedule, then automatically body does not have a choice. It has to bring sleep whatever it is within the time which is allowed. So that is more healthy when compared to sleeping at whatever time possible. So create a regular bedtime routine and a clear sleep pattern without a daytime nap is the important lifestyle change which has to be done. Next slide, please. Coming to our favorite filter coffee. So I'm not against a filter coffee. Coffee definitely is, we all like. We all get addicted to at least one compound in our life, that is coffee at least. So I'm not asking anyone to stop coffee here, but I'm trying to say that probably at least avoid 4 hours before bedtime. It is well scientifically proven that tea or coffee both contains caffeine and theobromine, which are stimulatory agents, and probably at least 4 hours to 6 hours before bedtime is always it should be the last one. Definitely not an espresso or a cappuccino at the night. So that is the important message I wanted to say. If at all, there are some people who feel that having a lukewarm milk at the night actually improves their sleep. That could be tried. It can suit for some people. Avoid a heavy meal at night. That also helps. Probably along with it, I will, especially in elderly, it is very important that probably we drink less water, especially the last 1 hour before sleep, because we can have a lot of urinary frequency can be more. Because of the nature calls, our sleep can also get disturbed. So probably you can drink a lot of water 1 hour before sleep. Probably the last hour can be sips of water to just drench your thirst, but not too much of water. Probably have to go for a washroom before the bed and then go for the bed. So definitely caffeine need to be avoided. Diet should be simple and avoid water intake in the last 1 hour, except for quenching the thirst. Next slide, please. The medications for sleep, probably definitely avoid stimulants like cigarettes, alcohol, which has been known to actually create more problem rather than helping. So there are so many people who believe that alcohol improves the sleep, but unfortunately we do see that initially it helps, but later it creates a situation that only if you take alcohol you will be able to sleep. So it really induces an addiction and makes you sleep. Gradually, it makes you to drink more and more and more and more. At the end, we become dependent to alcohol, but we don't improve our sleep at all. Hmm? Also, avoid sedatives, sleeping pills to help you sleep. There are so many people who come to me who just buy melatonin supplements online, but that may not be a good practice. So I will probably give you a few more techniques to improve the sleep as well. So these medications are not really not in a regular practice, need not be taken. But if you feel after what doing whatever I say in this next 15 minutes is not helping you, then probably it is time for you to consult a professional before thinking about medications for sleep. So over the counter medications for sleep is totally not advised. It can make your sleep more chaotic rather than creating improvement. Next slide, please. The important other thing which we advise to improve the sleep hygiene is an exercise. Exercise before bedtime probably is not advisable. Many people do think that make if you are tired before bed, you will sleep. But actually, it's the converse. Many people exercise just before bedtime keeps you more awakened, more stimulated, and it actually disrupts the sleep. But exercise probably by the evening, probably a moderate exercise and preferably an aerobic exercise, especially a walking, definitely will help in the sleep. So evening moderate aerobic exercise like walking is advised, not definitely a strenuous exercise before bedtime. A gentle yoga exercises are also welcome to be done before bedtime. Next slide. So a walk along with your partner will be a very good idea to go on in the evening. Next slide. The other technique which can be used is something what we call relaxation technique. So more relaxed you are on the bed, it is easy to get sleep. So breathing is one powerful technique which has been shown to basically relax yourself. Okay, breathing also calms you down, reduces your heart rate, and soothes the onset of the sleep. There are certain techniques which can be used, like square breathing, color breathing, and balloon breathing. These are all powerful breathing relaxation techniques which can be used before the bedtime, not on the bed. Okay, so square breathing is where we imagine a square and probably we trace our eye along the edges of the square and also trace our fingers along the edges of the square, and then in our mind imaginatively we every time we we move our eyes along edges of the square, probably you deep breathe in and then deep breathe out. So if I say there is a square from the right end to the left end, I gradually move on. I take a deep breath in and then I move on to the next point. I take a deep breath out. So, and then you constantly do in the same way, it relaxes you. Color breathing is one where you can select any color of your choice. And probably when you breathe in, you take the entire, you can imagine that you can take that entire color as you breathe in. Let's say my favorite color is red. So I take red inside, which calms me down, and then breathe out the same color out. So I imagine taking in that color in, and then imagine that I breathe out that color out. Balloon breathing is where we imagine that our lungs are actually the balloon. So we when we breathe in, we inflate the balloon within ourselves, and then when we breathe out, we deflate the balloon within ourselves. So these techniques are powerful techniques which can be done probably 10 minutes to 15 minutes before bedtime, which can be after that. When you feel relaxed, you can come to the bed. Next slide. Many times, even after all this, people say that I don't do get good sleep. Right. So people have tried different ways of relaxation, like counting backwards, saying some slogan, saying some prayers, like that. It goes on. Each have innovated their own technique to make them tired, like moving their eyes from right to left, and various things. Along with it, that sleep worries also come in. What if I, like, for example, what if I don't get sleep today as well? So this is a common sleep worry which comes up once we go to the bed. So commonly also, if I don't sleep, whether I will fall ill is another common worry. If I am is not sleeping a disease by itself, I will become ill while all others can sleep. Let's especially when your partner is able to sleep on the bed, while why on earth that I alone can't sleep? And what can we cook tomorrow? And then it goes gradually to how is my daughter? Oh, how will my daughter take care of her children? And then it gradually goes on worry, one after the another, and then it branches out. It is more a snowball effect. one issue, one's worry results in second worry, third worry, fourth worry, 100th worry, 200th worry, and goes on and goes on. So if you see, the sleep worries by itself are natural thing which comes for everyone who are not able to sleep. We don't do anything intentionally. We don't want to think and disturb our sleep. It is quite natural for any human to have a sleep worry when they are not able to sleep. But what point I'm trying to say here is that having a sleep worry is normal, but labeling that it is actually a sleep worry and understanding that these worries are not going to help with the sleep and not giving importance to the sleep worry is the most important strategy which will help us to move into the sleep. So I will rather request you all to look back when you go to the bed. Do these type of worries creep in? In that case, it's quite natural for it to creep. But what we have to do it is just label it. These are worries anyone can have. These are just thoughts. These are not facts, but these are just thoughts anyone can have. If we give more importance to these thoughts and believe these worries, it will definitely delay our sleep. If we don't give importance to it and move aside, these thoughts will go away. Sleep will be much earlier. Okay. So next slide, please. Yeah. This slide, I want everyone to focus. This is something what we call as stimulus control. To sum up, there are two tables side by side, one being good stimulus control and other being stimulus discontrol. So if you see, these are nothing but do's and don'ts on the bed. These are well proven techniques which are considered stimulus for sleep disturbance. So if you control these stimulus, then you will be able to sleep earlier. So some of the goods are basically having a clear bedroom time and you use bed only for sleep. Whereas what are the things you should not do on the bed is probably eating, reading, or watching TV, or having a disordered sleep time, or disordered irregular bedroom routine, working on the bed, worrying on the bed, and probably sometimes when you become so bored, cleaning. So all these are probably not the good ways. These are don'ts. These are all exactly the stimuluses which can result in poor sleep. So these stimuluses needs to be controlled. The only way to do it is avoid all this on the bed and have a regular sleep routine, and bed is only for sleep and not for anything else. Next slide, please. So some of the things of this stimulus control training helps you to basically take away unnecessary things with worsen your sleep. One being probably having an alarm clock. So it is quite normal that probably when we don't get sleep, it is often we look and glare at the alarm clock or wall clock or a mobile, whatever it is, and then feel, oh, it is only two. Still more 4 hours to go for me to sleep, to get up. So that actually worsens the anxiety. So definitely removing the clock is a very important thing. Lie down on the bed only when sleepy. So if you are not feeling sleepy, don't go to bed. But when you go to bed, when you are not able to sleep more than 15 minutes, if you feel you are tossing down, you are not able to sleep, unlike the past, just get out and then go to the near room, have something to read from a book, which is probably a boring book. And when you feel sleepy, come to bed. So the major idea of the stimulus control is you don't unnecessarily toss. When you toss unnecessarily, all the sleep worries creep in, as a result of which your sleep will get more delayed. So definitely don't go to the bed at the same time. 15 minutes not able to sleep. Definitely come to a nearby room, read books. Don't force yourself to sleep. Sleep when you get sleep. So this method is a very powerful method and scientifically proven method. So during the initial days, you may actually, by this method, sleep even 1 to 2 hours, but you still don't nap in the next day. You create a sleep pressure, and when you every day you practice the same routine, body has no choice but to bring in sleep in that time. So that is the important thing of the current today's presentation is the important slide. I will say this is the one. So practice this every day, and you will see in a month or so you will be able to sleep to your expectancies. So next slide, please. So sleeping, Frederick Niche, I'm not able to pronounce his name correctly, but Mr. Frederick, as a famous person who has worked a lot in sleep medicine, have actually told out that sleep is no mean art. For its sake, at least one must stay awake all day. Okay, so with this, I thought I have given a gist of what happens with sleep, what is the normal things during sleep, and what are the common do's and don'ts. And probably I've finished the thing which the important thing called stimulus control, which I think if everyone follows, it will be definitely able to help you with the sleep hygiene. And I personally feel it is quite effective even in people who come to my clinic and hospital stating sleep problems. So I have a full confidence that this stimulus control techniques helps a lot. So sleep hygiene is a simple behavioral technique when followed can improve a sleep. If not able to sleep, definitely work on with consulting a professional and seeking help for it. Thank you.
Thank you. Thank you so much for an informative session. So we have, we had asked our clients some if they would want to ask any questions. So we will start with the question answer session. The first question is by Geeta ma'am. I think it is already answered. Maybe you can just emphasize on that. Does use of electronic media just before sleep time disturb the sleep pattern?
Yeah, definitely. I think electronic media, all medias, all screens, and hour before sleep is a strict no.
Okay. Yes, Geeta ma'am, your question is answered.
Yeah,
Okay.
the next question is from Maithili ma'am. Do we have a fluctuation in the oxygen level when asleep? How does it affect us? How can
How
we
does it affect
control?
us?
Yeah, how
Okay.
can we control it if needed? What is the
Mhm.
normal percentage of REM,
Mm.
light sleep and deep sleep for senior citizens?
Okay. To sum up, probably oxygen levels are known to fluctuate during our sleep. It is quite normal that during our deep sleep, we breathe at a slower rate, as a result of which our oxygen levels come down little in our blood. And then during the superficial sleep, it becomes better. But it is not to a significant level. Definitely, it is not below 98 percentage as we see in the what is that finger? What is that called? We all have started checking SpO2
Oximeter.
in our oximeter. Yeah, yeah,
Pulse
right.
oximeter.
So it will definitely not less than 98. So our body is tuned to have that fluctuations, and it definitely does not disrupt our sleep and nor our health. But there are some people whom we see that who almost stop breathing. They have a loud snoring, and the bed partner can really understand that they snore and suddenly stops breathing for few seconds, and then they again start to snore. If that is the case, probably there are many people who can have a significant reduction in oxygen. That needs a pulmonologist consultation. Otherwise, we need not worry about the oxygen levels being dipped during the sleep. Second thing about the REM sleep, usually, as you say, the non-REM sleep is more during the childhood, and it reduces. That is, deep sleep gradually reduces as we catch age. The frequency and the duration of the deep superficial sleep, that is REM sleep, gradually increases. So it is high likely that we may have more light sleep as we catch up. Even small noise on the floor will immediately wake us. A small door knob or a screeching noise will be able to wake us, but we need not worry much about it. That is how our sleep pattern will be. We need not do anything special to improve the sleep. What apart from whatever techniques I told, even after doing all these techniques, if you still feel your sleep is superficial, probably we have to accept it and move on. We have to just accept that the sleep has become more superficial, not accepting and probably forcing yourself doing a lot to improve the deep sleep. In fact, worsens the anxiety. The anxiety results in poor sleep again. So I do say a lot of people don't probably judge your sleep based on the last dreams you had, based on awakening in the middle of the night. So I usually say to them, it is perfectly okay to get up 2 or 3 times in the night. It's perfectly okay to stay awake 30 minutes whenever we go for a nature call. And it is perfectly okay to get up by around 5 o'clock in the morning with a lot of dreams. If they feel that if it is too much, then probably a consult is required. So we need not do anything specific to increase the REM. Probably whatever techniques we do will probably decrease the REM, and then it will help to improve the sleep.
You already mentioned about this nature call. Actually, there is one question from Dolly Auntie. The question is, what is the best way to go back to sleep after nature's call awakens as midway during a good sleep? That's her question, actually.
Okay. I understand. I think this is one of the common thing. So the best way to go back to sleep is after the nature call. Probably if you're thirsty, have only sips of water. Don't drink too much water, or else again in another 1 hour we have to get up. So have the least amount of water even when thirsty. Then go to bed. You need not do anything to force to sleep. You just need to wait for the sleep to come. If by 15 minutes, if you feel you're not getting into sleep, don't worry. You just need to basically get up from the bed, have a book nearby, and then start reading by sitting in a chair, a boring book or a boring newspaper, something you don't like at all. And once from a newspaper or a book, and when you feel you are getting sleep, go to bed. So the idea, what I'm trying to do is I'm really taking you out from the idea that most of the time people force to sleep. They crave for sleep and force. More they force, more it jumps back like anxiety jumps back like a spring. So it is totally not advised to basically force yourself at night when you get up. So best thing is to go, if you're not, try with 15 minutes. If it is not helpful, don't force yourself. Wait for the sleep to come. When it comes, you come to bed. Again, 15 minutes try. If you don't sleep, go back to the chair, read something. When you feel drowsy, come back. So when you do it repeatedly in several days, the same technique, at a point you will be able to see that whenever you come to bed, your sleep automatically comes. So training your body to get into sleep once you go to bed is probably more important. If you stay on the bed with lot of all these worries, the bedtime gets associated always with these worries. So as a result, whenever we go to bed, we feel dreaded, whether we will get sleep or not today also. So we want to not have that. So the best way to do this is when you feel sleepy, you go to bed, try for 15 minutes. If not, come back. So try this consequently in a few probably weeks to months. This will become much easier. So within a few minutes, you will be able to.
Thank you so much. We have Padma Auntie from the US. She wants to ask a question. Auntie, please unmute yourself. Yes,
No,
Auntie.
yeah. My younger days, there are so many incidents which is affecting me now. I'm not able to sleep. Suddenly, all those thoughts, I want to avoid those things. I don't. Now I am very happy and all my peaceful life only. But still, those things always comes and just they drive me crazy.
Correct.
That's how how to avoid those things.
Yeah. So one thing what we try it out is this relaxation before sleep, man. So you can definitely try it out, this breathing techniques or a gentle yoga or a pranayama before sleep. And whenever the sleep worries come, probably you have to label and understand that unnecessary worries are coming. Probably that means that you are not getting sleep. What I said in the earlier thing, you just get out of the bed. That is the big thing. More time you lie on the bed without sleep, that there lies the problem. That worsens the anxiety and delays the sleep. So the best thing is to probably not to allow your mind to ponder. So if you're not getting sleep, kindly move out to a nearby chair and read something at a low light. That when you feel sleepy, you come back.
Okay, thank
next.
you.
Thank you,
Okay,
Auntie.
thank you.
Next, we have Subramaniam uncle who has raised his hand. Auntie,
Hello.
here.
Yes, I'm Vasanta. So, what happens, when I see the TV and all in the hall, I feel very sleepy because the afternoon I try to avoid sleep. But once I get up from there, go to bedroom, I become very fresh. So I want to know, can I start sleeping continuously in the sofa only? It will help me out.
Or probably it's very paradoxical. I understand, and I understand
I
that you
tried
are
lots of times.
frustrated. Well, yeah, you are in fact frustrated that you are not able to sleep after a TV. Yeah?
I become very fresh.
So what we can probably do is, I understand that as per your body, your sleep onset is quite earlier. Let's say at around 8 or 9, you are on the TV. Am I right, ma'am?
Yeah.
Yeah, probably looks like you, for your body, the sleep almost starts by around 8 o'clock. So I will rather say at that time, don't be in front of the TV. When you feel sleepy, probably switch off that and then go to bed thereafter itself. So you can also see that if you feel that by around 8 o'clock you will usually get sleep, don't switch on the TV at all by 8. So go to directly to the bed, wait for the sleep to come, because once your body is tuned to that 8, you will probably get sleep every day on that 8. So you may be probably able to sleep immediately. So probably you can avoid the last minute serial and that program and the TV and that one.
That makes you also, you have to see the serial, otherwise the sleep doesn't come properly. The other problem is, like one thing I would like to share with everybody, that once I want to go to sleep, I go to the washroom and come back. What is I take 3-4 deep breaths I take only. Then I feel like sleeping. This is my experience and I want to share with everybody. Maybe it is good for a deep breath, but that makes
Yeah, correct. Definitely. Deep breaths. There are various techniques people do for them. So people have innovated based their own techniques. But the idea is that relaxation definitely improves. But if you feel you are anxious, don't force. Let you sleep when it comes. And you create a sleep pressure. Definitely, gradually your body will learn that you are giving only this time, and it will bring the sleep whatever it needs during that time.
And one more point which I'm experiencing sharing, like after breakfast, like 10-11 o'clock, we give for 10-15 minutes if I have take rest. Afternoon I don't feel like sleeping at all. Then night I can go off to sleep. That because before breakfast, after breakfast, not after lunch. After lunch sleeping makes you
bedding after. Yeah. There are various things are there. There are evidences to show that daytime naps actually helps us. But many times when we have a sleep problem, it is better to avoid post breakfast and post lunch sleep. So many times, even as people often say, they don't even sleep, they just lie down.
Yeah.
They just lie down on the sofa. Even that, unknowingly, we sleep and nap. And that also, many people, it disrupts the night sleep. So if you have a problem at the night, definitely avoid post breakfast and post lunch sleep.
Thank you.
So if we don't have the problem in the night sleep, is it okay to take a nap in the afternoon?
Yeah, that should not be a problem. If you have a problem, it means that the sleep pressure is not created. So if you don't have a problem with the night sleep, you can sleep, no issues.
Okay. Okay. Nimita ma'am is here. Ma'am, if you want to unmute yourself and you can ask your question, send a question you want to ask by yourself.
I think we can ask on her behalf.
Okay. Yeah, she is asking, in spite of not taking tea in afternoon, no nap, I take caffeine-free green tea. I can't take milk or bananas at night due to cold tendency. At time, I take quarter glass of cold milk or 3 to 4 spoons of ice cream when I feel heat in my stomach. Then I get sleep. I am pre-diabetic, she is saying.
Okay. Okay. So if you see, it's a myth that tea does not have caffeine. So it is actually, we all think that actually coffee alone has caffeine. But the important thing is that tea also has caffeine and coffee also has theobromine. So it's the basically tea is not devoid of caffeine. So tea is equally a good stimulant. Tea also has other stimulants like theobromine instead of caffeine, so that anyway it is another stimulant. So definitely tea and coffee may not be a good idea. A warm, lukewarm milk may be of a good help. Ice cream probably, with considering the pre-diabetic status, may not be a good option for you. But usually I have not heard people taking ice cream for sleep, but I'm not, that can be avoided. So what is better?
Okay, thank you. Any other question from here? Anybody, if you have any
Feel
questions?
free to unmute yourself and you can ask a question. Santoshi aunty?
Yeah. Keeping an alarm and sleeping is good or not good?
Probably alarm at 6 o'clock is okay.
Before
will not
that?
be a problem. Before I mean, what I'm saying is
5:15, 5:30.
Yeah, I mean, if you feel that is your sleep routine, that's not be a problem. But only issue with the sleep alarm is people, when they keep a timepiece or probably an alarm in the mobile, it is often, we also, when we don't get sleep, we will look at the time again and again. So one of the thing is probably you can keep an alarm probably at the end of your sleep, but not access your phone during that time, phone or timepiece. So it should not be visible to you.
No,
Because
sometimes when the alarm is on, I may be in a deep sleep. Is it getting up so sudden like that is okay?
If you feel that is not the usual time, kindly keep it later. You know, usually we all have a sleep, superficial sleep. It is better to wake up in the superficial sleep. So if you feel you are getting most of the time under the deep sleep, then probably you can keep an alarm little later, 6:30 something, so that by that time superficial sleep would have come an hour after that. That will be better.
No, I do yoga early in the morning. That's why I'm asking.
Oh, or you have to probably what you can do is probably your night sleep time should go. It is basically based on one model that everyone have typical few hours of sleep. So some are okay with 7 hours, some are okay with 6 hours, some are okay with 8 hours. So if you feel you need a long sleep hours and you are always getting up at the deep sleep at that 5:30, it just means that you have to sleep earlier so that you get an adequate sleep duration. By that time, probably let's say 1 hour earlier, if you can go to sleep, it may be expected that by around 4:30, your deep sleep may come down. And by the last 1 hour, 4:30 to 5:30, you may have a superficial sleep. So you may be able to get up much easy. So try to prepone your sleep time along.
Sure. Thank you.
We have Chandra aunty. Chandra aunty, you can ask.
Yeah, I'm a very light sleeper. I don't sleep much. Hardly I sleep for 1 or 2 hours. That too, as soon as I sleep, I get sleep 1 hour or 1.5 hours. Then I wake up. Then I don't get sleep at all. Then probably in the early morning time, 4 o'clock, I may be feeling sleepy. But I feel that I should get up because I can't sleep. that I don't know, somehow I have to get up by 4:30. I sleep after 4:30. I don't sleep. The day, Saturday, Sunday, whatever it the day, I get up by 4. So then, then in the daytime I feel some drowsiness is there. So I don't feel very. So sometimes I go to bed in this thing afternoon. No, not in the bed. So I will sit and I will nap for 10-15 minutes. Then I will get up. I don't know. Then I feel that if I sleep in the afternoon, I may not get even the 2 hours sleep. I will not get in the night. I used to get that fear. So that is the with me. And another thing, when I go from here, I'm staying at present I'm in US. So if I go to India, the jet lag is really bothers me. For almost 15-20 days, I will not be sleeping. So I will be, see, if I think that if I sleep in the daytime, I will not be able to sleep in the night. Okay, if I don't get sleep in the night. So this is a big problem for me. At least for 15-20 days, I don't sleep at all in this process. No time sleep, no nighttime sleep. So anything
I understand. I think jet lag, if it is there for 2 or 3 days, it is fine. But you
for
seem
me,
to have
it
a
is
prolonged jet lag. Yeah, if it is prolonged, I will rather say these sleep hygiene techniques may not be enough. Probably we can check with a sleep specialist nearby, or you can consult someone during that time. There are certain things which can be given to again restructure your sleep. Probably if it is so prolonged, definitely check with a sleep specialist or a psychiatrist nearby, so that we can help you with that, rejigging it up. But one thing, the common myth we have or the fear we have is, if I don't sleep in the morning, and whether I will not even get that sleep in, I mean, if I sleep, I mean, even if when you feel drowsy in the morning, if I don't sleep that 2 hours in the morning, I may not even get that even at the night. That is usually a myth. This is all because of our fear. So when we don't create a sleep pressure, many times night sleep will be disturbed. So I will rather request you, even if you don't, if you feel sleepy in the morning, never sleep. Don't take a rest in the morning. You need not force yourself to the sleep at night, but because you have created a sleep pressure, automatically the sleep will come. So, but for the jet lag, I will request you to check with the specialist also.
Okay. Because I took, because for 20 days I didn't get sleep. Then I took one day, my brother-in-law told, why didn't you have one sleeping pills? But that was horrible for me because I was getting some dream, like, I don't know, I was floating somewhere. So it was horrible for me. So then I didn't take sleeping pills because I never take any sleeping pills as such. So that time I took sleeping pills and it was very horrible for me. I don't know. Thank you very much.
Thank you.
I have a question, please.
Yes, Lakshmi ma'am.
This is Dr. Pradeep.
Yeah.
For a patient who comes to you for consultation, can it be done online, or do you have to meet the person? Because this is
Online
a sleep
is
issue.
also fine.
Online is good?
Yeah. Online is anyway legally allowed within the jurisdiction of India. So anyone within India, I can definitely see. Outside India, one, that's not legally allowed, and the prescriptions are not probably generated in India, is not recognized abroad due to the local abroad.
Thank you.
Sure.
Any more questions?
Yeah, I want to ask one question is that, I get sleep early, like 9:30, 10. But 1 or 2 o'clock, like I get up, and after that I can't sleep at least for 2-3 hours, or sometimes I don't get sleep at all. So, and all various thoughts keep coming in the mind. So what to do about it?
If you feel sleep is very much disturbed, you are not able to sleep at all. Let's say you are staying awake, probably trying the sleep hygiene for a month will be one thing we can do. If it is not helping, definitely look for a psychiatrist or a sleep specialist nearby. Sometimes sleep disturbances could be due to various issues and worries which we have. which need to be addressed, then only the sleep may become better.
Okay. Thank you.
Sure.
Any more questions?
Thank you. Thank you so much, Dr. Pradeep, for your precious time. And it's a very, very useful talk to our clients. It will be very, very beneficial to everyone here. And with patience, you explained everything to all of us. Thank you. Thank you so much again.
Thank you. Thanks a lot.
Thank you. Thank you all for joining us. Thank you, Dr. Pradeep.
Thank you. Thank you, doctor. Thank you.